Welcome to another episode of Monday ReTsene. My name is Re Tsene, and today I'll be talking about another mental health related topic. Today I'll be looking at depression and suicide. There are two different types of depression that I'll be discussing. The first one is major depression. I was listening to one of the biggest podcasts in South Africa, and one of the speakers mentioned that the opposite of depression is not unhappiness or happiness. This means that the opposite, depression, is not feeling sad, because feelings of sadness are very common, especially when we encounter different life stresses. She further said that depression is the lack of vitality. This is characterized clinically by diminished or lack of interest in the things that a person usually or used to like. And this might also accompany feelings of sadness, a state of loneliness, feeling less happy most of the times, excessive sleep, characterized by excessive sleeping, or insomnia, high appetite or less of appetite, where they can even result into losing weight, attention and concentration difficulties. So those are the symptoms that are associated with depression. With major depression, also known as clinical depressions, these symptoms must be present for at least 2 weeks. The next type of depression is persistent depressions. So the symptoms that we've discussed above must be present for at least 2 years. This is very common amongst individuals who are high functioning. So these individuals in society, in real life, they would be achieving very well in various aspects of their life. So they could, in their careers, they could be occupying the highest position and accomplishing the best strategies, or just doing well all around in their personal and private life. But these people at the end of the day might define themselves as feeling empty, as feeling suicidal, as feeling lonely, and as feeling like they're not satisfied or fulfilled by the things that they used to enjoy. These are some of the symptoms that are associated with persistent, and also, which is also known as chronic depression. So suicide ideations or suicide thoughts or intrusions are also very common amongst people who experience depression. So these people would usually start by experiencing depressive symptoms, and then they'll talk about being suicidal, thinking about committing suicide, and a therapist usually knows that a person is suicidal when they actually have a plan of action in terms of how they are planning to commit suicide. It is very important that we listen to individuals, especially when they move from a point of defining depressive symptoms and talking about suicidal thoughts. And the history of suicide attempts is also an indication about the seriousness of the person's depression and whether or not they are more likely to commit suicide. And it's important that those people we do seek immediate help for them, or become the help that they need, or create a supportive environment for them. So if you are experiencing any of the symptoms, it is very important that you do get the necessary help, be it therapy or consultation with a counselor, or speaking even with your GP, who can also make the diagnosis. These symptoms are very, very important, and sometimes if you do not have the supportive structure in your family, you can go outside, look for, we're not all privileged to have people who are supportive within our families. So it's okay to look towards your friends, towards your partners, towards your colleagues for support. And sometimes you can even use a therapeutic relationship as a form of support. Thank you for listening, and I hope this video was informative. Thank you.